Why is there no one exercise to help heal painful hip arthritis? Healing hip osteoarthritis is a process of many exercises that need to happen over time. These exercises need to change in the style, the variety of exercise, but also the intensity of the exercise, the number of reps, the weight used, the resistance used, the pace, the cadence, the frequency. There's so many different variables that need to happen and change as you progress somebody from having painful hip arthritis to feeling confident and having a healthy hip. Other factors depend on the things that are unique to you. Like for instance, we have people sometimes that have back pain that also have hip arthritis, and so we need to go back and fix things about their back pain. And then on the other end, we have people that have knee problems, maybe even knee arthritis, and it depends on factors that are unique to you. For instance, we have people that have back pain problems that also have hip arthritis problems, and we have to go make sure that the back pain problem is taken care of so that we can thoroughly fix the hip arthritis problem. And then we have other issues like knee and foot and ankle problems that need to be addressed in order to be successful at addressing the hip arthritis problem. Because of these issues, these unique issues, depending on your specific situation, we'll need to tailor the program slightly in order to make sure that hip arthritis is successfully taken care of. Even general healthcare professionals out there that you may be seeing for a hip arthritis problem may not see things this way because they're not experts in helping people avoid hip replacement surgery. Most healthcare professionals out there are experts in medicines and surgery. For instance, a doctor of medicine is a specialist in medications and medicines, things that you might inject or things that you might take by mouth, versus a surgeon is a medically trained doctor that has gone through extra training to learn surgery, and they're experts in surgery. And should you need surgery or medications, you should definitely see one of those professionals because they're going to be experts at helping you in their respective fields. And even physical therapists, who are usually considered exercise specialists, are generally seeing people after they've had a surgery, and so they tend to be experts at helping people recover from surgeries. They help people get back to walking and back to doing their normal things after having a surgery. But they're typically not knowledgeable about understanding the root cause of the problem that led to that surgery to begin with. If it was a chronic condition like hip arthritis, for instance, it's different if it was an accident like a car accident or some severe fall or trauma that happened, then that's a different root cause. And it's not my intent to throw anybody under the bus. I think that all of these healthcare professionals are doing the absolute best they can with what they know. And when you show up to their office with a problem that they feel they can help and they don't know of another expert like myself that might be able to help you out in avoiding hip replacement surgery if you have hip arthritis, then they're going to do the best they can with what they know. So they're going to give you medications, they're going to offer you injections, they're going to suggest surgery. If you go see an exercise specialist like a physical therapist, they're going to give you hip exercises that they're used to giving patients with hip problems. And if those patients tend to be people that just had surgery, then you're probably going to get the same exercises for your hip arthritis pain that they gave to the patient that's recovering from a hip replacement surgery. And these exercises very commonly involve using a bike, going walking, and swimming. And sometimes they'll do a certain exercise like a bridge that might have a lot of benefit. And when you feel better from doing a bike or walking or swimming or doing like a bridge exercise or any other exercise that actually did give you some short-term relief while doing that therapy, then it's easy for the therapist and the doctor and even you as a patient to say, oh, this one exercise fixed my hip arthritis, but it didn't solve the whole problem. It didn't take you through that whole process that I'm talking about to resolve a hip arthritis problem in order to avoid a hip replacement surgery. And I can tell you from experience that it is truly a process, and it's similar to like losing weight. It's rarely just one thing that you ate or even just a few meals that you had that made you lose weight. It's some sort of consistency over time and then changing it over time in order to drop down even more weight and to get to the next level and to put on muscle on top of that. You need to add another aspect to your program. There's different things that you need to add, different components that make up an entire process in order to achieve a massive goal like losing a lot of weight. And it's the same thing with solving hip osteoarthritis so that you can avoid a hip replacement surgery. Now, I want to let you know that I talk a lot about how to resolve hip arthritis on my YouTube channel here, and I've put all the videos that relate to hip arthritis, including exercises, tips, and advice, in a playlist called the Hip Arthritis Help Playlist. You can find that playlist, the link to it down in the description below. And I've also put together a comprehensive program called the Hip Arthritis Recovery Program, where I put my treatment approach in over 30 videos. They're all structured so that you can go step by step and figure out what you need to be doing right now for your hip arthritis. It's the entire process, so that you can get back to lifting weights, maybe even exercising, running, at least going on longer walks and being able to do all the things that you love to do. You can get that program down in the link in the description below as well. That program is accessible to you anywhere you have an internet connection, and you can access it anytime you like. If you thought this video was helpful for you, please give us a thumbs up. Please share this with somebody you think needs to see this. Drop a comment below and let us know what you think. And don't forget to subscribe and turn on the notification bell so that you don't miss out on any of the videos that we upload each and every week. Thank you so much, and I'll see you in the next video. Bye-bye.